Every day, Misael Guerra faces the difficult task of filling oxygen tanks to help his father, Juan, survive COVID-19. Juan is 79 years old and is struggling with coronavirus at home.
I don't trust in the government and how it's treating people in hospitals. Clinics are so expensive that we can't afford it. The cheapest clinic we found wanted to charge us an initial payment of $3,000 and then $1,500 a day, and that's something we can't pay.
Finding oxygen is not easy. Misael's father has been at home for more than 2 weeks and needs 4 oxygen tanks a day at a cost of $70 per tank. Misael has opened an account in GoFundMe to get financial help.
This is the 3rd day of the GoFundMe campaign, but we can't withdraw the money until the 14th. We've been able to get some money, but there are a lot of people whose relatives die before they get the full amount.
Venezuela's healthcare system was already struggling prior to the pandemic, and even though last year the infection rate was relatively low due to the widespread gasoline shortages that restricted vehicle movement, infections have been going up in recent weeks. Doctors across the country have been protesting for improved testing and vaccines and complaining that the official coronavirus figures provided by the government are false.
They're not carrying out enough testing, and that's why the figures are low. 3 weeks ago, we carried out 120 tests a day, and now we're not doing them anymore. We're seeing at least 40 people a day that we suspect are sick, and we have no capacity to corroborate it.
Venezuela's vaccination campaign is behind most other countries in the region. The government has received around 750,000 vaccines from Russia and China. President Nicolás Maduro has been negotiating with the opposition to obtain vaccines via COVAX program, using funds frozen in the United States. But Maduro has refused the AstraZeneca vaccine, following reports of blood clotting.
Most of the world will continue using AstraZeneca in spite of the recent problems. COVAX has other vaccines, but within the COVAX mechanism, the way Venezuela is classified, we cannot choose the vaccine. In order to do that, Venezuela will have to change its standing in COVAX, but it's difficult because of its financial situation. If Venezuela paid $130 million, then it would change its standing in COVAX and the situation would be different.
There are over 2,000 GoFundMe campaigns to assist COVID patients in Venezuela. As hospitals fill up, citizens are resorting to desperate measures to save their loved ones, while hoping help will arrive on time. Teresa, Al Jazeera.